Good day, I am Alessandra Denise DC Junicio, and for today's demonstration, I will be performing obtaining nasopharyngeal swab. So upon entering the client's room, we need to close the doors, the windows, and the curtains to provide privacy of the client. And then after that, we will be needing to bring all the necessary materials needed for the procedure, which are the swabs, alcohol, and the gloves. And then we will check the expiration date of the swab to make sure that it is accurate for the procedure and to ensure accurate result. And then after that, we will perform hand hygiene and wear PPEs if indicated. Performing hand hygiene and personal protective equipment will prevent transmission of microorganisms. Then after wearing PPEs or gloves, we will identify the client and explain the procedure. So, good day ma'am, I am Alessandra and I am your nurse for today. So, what's your name po?
Angelina.
So for today, I will be performing nasopharyngeal swab, which it identifies and detect the infectious disease that occurring. And this procedure will establish rapport and provides comfortability of while doing the procedure. Then, check the specimen for patient's identification, which it includes the name of the client, so that we will identify that the right patient is the right client who will receive the intervention. So, check lang po natin kung tama po. So, Anginette po yung name. Okay po. So, nakaschedule po kayo for swab. Ask the patient to open her mouth and inspect the back of the throat because we will obtain the specimen mucosa on it. Open po yung mouth and using the palm depressor, we will inspect it. And then after that, after inspecting the mucosa, we will open the packaging of the swab by peeling it off, and then we will open the swab from the tube. We will make sure that the specimen are sterile, and we will grasp it at the tip of it and get the swab. And then after that, we will continue to the client to open her mouth and her head are upward, and then we will insert the swab 6 inches from the nares to nasopharynx and rotate it for 15 seconds to 30 seconds. Open po. We need to observe for the nasopharynx so that we will identify and get accurately the specimen needed. So, open na po yung mouth. Observe lang po natin. Then, we will insert the 6 inches of the swab. So, we will put it from the nares to the nasopharynx and we will rotate it for 15 seconds or 30. As we get the specimen needed for the lab test, we will put it again to the test tube. And make sure that it will not touch any surface. And then we will dispose all the equipments we need. And by disposing it, we will dispose it by depending on the policy of the hospital. And then after that, we will put the swab on the sealed plastic to ensure the protection of the swab, and we will label it by the name of the client so that the right client will receive accurate result of her lab test. Then after putting it to the sealed plastic, we will remove all the PPEs we use for protection, and we will remove the gloves and performs hand hygiene to prevent transmission of microorganisms. And then after that, we will immediately transport the test or the specimen we need for the lab result. We should transport it immediately for accurate result, and if it will not be transported immediately, we will check for the instructions if it can be refrigerated so that it will maintain the accuracy of the result. And that's all, and thank you.